My name is Karen Hill. I'm in Ottawa at the home of Dorothy Zarsky. It's January the 6th, 1983. Mrs. Zarsky has agreed to be interviewed for the Canadian Association of Social Workers project on the oral history of social work. Mrs. Zarsky, I wonder if we could begin by you telling us a little about where you were born, your family, and your early background.
I was born in Alberta in a little tiny place that I don't know whether it even exists anymore. It was so small, called Haines, Alberta, and moved around within Alberta when I was small on a number of places, and essentially grew up in Wetaskiwin, just south of Edmonton, and took public in high school there, and graduated from high school in the 30s, which meant two things. One, there was no money for going to university, even if I'd known what I wanted to do, which I didn't. And two, that jobs were practically non-existent. So I can sympathize with the young people now who are searching for jobs, because I can remember doing rounds of places that I knew perfectly well that they didn't have any work available, but still you had to try. And my first job, which was a secretarial, I suppose, I got paid $1 a day for the days I worked, which even in relation to the value of the dollar at that time didn't go very far. When I was in, I don't know, last year of high school probably, one of our teachers asked us what we wanted to do. And one of the students said social work, and I hadn't a clue as to what it was.
And did you find out? How did you find out?
Not then, no. I got into social work sort of by accident. In 1939, I got work. Well, I'd worked with the provincial government a little while before that, but I got a job with the federal government, and eventually ended up in the Dependents Allowance Board, assigned to one of the two divisions that were dealing with families of servicemen who had problems. And the supervisors of those two divisions were social workers. So that really was my introduction to social work, and I decided that that was what I wanted to do. So
when you were working with the Dependents Allowance Board, was that in Wetaskiwin?
in Ottawa.
You had moved
I'd moved from Wetaskiwin to Ottawa at the end of 1939.
The work of the Dependents Allowance Board is something that is, given our complicated system of social welfare today, is something that many people might not be too aware of. Could you tell us a little bit about that?
It was responsible, in the first instances, for providing, well, arranging for payment of the pay that servicemen assigned to their families to see that it was paid to them, and then for providing allowances based on size of family to the families of the Canadian servicemen. So it started out primarily as a paying agency. Well, then, as time went on, you know, there were reports of family breakups with the husbands overseas, or problems with managing money for many of these families, because very often the wives had had no prior experience with managing the family finances. So that there were two divisions set up which were concerned with the social problems of dependents. One, a general one, and the other one which arranged for trusteeship for the allowances. In the case of orphan children, for one thing, or for families who simply seem to be incapable of managing them themselves. And to do that, we enlisted the help of social agencies all the way across Canada, and individuals in places where there weren't available social agencies which were prepared to help.
You were working through social agencies in local municipalities across the country. Did the Dependents Allowance Board negotiate that directly?
It wasn't so much a negotiation as simply a referral and a request for service. And there was not payment for the service. You know, I think this was considered part of the war effort for everybody. And the services were, generally, the request was very favorably received.
Was there much question at that time about eligibility for allowances? That seems to be a question that continues.
Well, of course, these were, the eligibility was simply the fact of the person being in the armed services and a dependency relationship of the person for whom the allowance was to be given. You know, wife and children was self-evident. Parents, parents was mainly assigned pay, that's right. The allowances really were for wives and children.
And your first was it a social work job that you were doing at the Dependents Allowance Board?
It was, in the first instance, a clerical job, which became essential. Then I was transferred to a different division. It was essentially very much a social work job, in a remote kind of way, because you didn't have direct contact with the people concerned. It was a correspondence and information referral kind of role. Also took a course at that time, because of the number of people working in a variety of social service agencies in Ottawa who didn't have professional training. Arrangements were made for one of the faculty members of the School of Social Work at McGill to come and give an evening course in social work. So I took that.
Who was that teacher?
Alice Taylor.
Yes, it's
She returned to the States later and has written written something. Can't think of titles at the moment. She was very good.
I'm wondering if we can stop for just a second. Something's occurred.
It was.
Go ahead.
Could I add? It was there that I met Marie Parr, who was supervisor of the division I was working with, as well as Ruth Harvey. It's a pity that she is no longer living for your project.
Yes. Marie Parr, now Marie Parr Gelno. Yes.
That's right.
Yes. Your work at the Dependents Allowance Board ended, I assume, when the war was over and things sort of wound down?
Yes, it would have done. You know, it was apparent it was, so I was debating what I was going to do after. I knew I wanted to go into social work, but I was going to have to work a little while longer. First, to save the money for going to university. So I'd gone home on holiday and was stopping off to see Marie Parr in Regina. She was then assistant director of child welfare there. On my way back, and she and Keith Armstrong talked me into coming to work in Saskatchewan. So that was my first attachment with Saskatchewan, apart from going across Saskatchewan on the main line of the CPR a number of times, which is really not the most prepossessing part of Saskatchewan to see.
So you worked as a child welfare worker in
Yes.
Regina. Maybe to go back for just a second, you said that you had heard of social work early in your high school career, 1938, 39 or so. What was it about social work that you heard later that convinced you that that was what you wanted to do?
Well, I don't think it was what I heard about social work so much as what I was involved in social work, in the job at Dependence Allowance Board. You know, we made these referrals to agencies about families that were having problems. We received regular reports from them, which we then had to report on to the men in the armed services who were overseas.
Mm-hmm.
And if you can think of a tough job trying to write a person who's in a war situation, that maybe his wife has developed a relationship with another man, for example, or that his family's broken up or something. And initially we were writing the letters expecting that the commanding officer would explain to the person, and then we got a request that we write them. They would still go to the commanding officer, but so that the letter itself could be handed to the individual. Well, you know, that's a hell of a way to tell a person what's happened to his life and his family.
Mm-hmm.
Anyway, it was in the course of doing that kind of work and the concern about the problems people were having, and that I decided that social work was what I wanted
Mm-hmm.
to do.
Did you have an idea then of the things that you hoped to accomplish over your career?
No, I don't think so.
Mm-hmm. And you moved on, and after you finished in working in Regina for several seasons, I guess it was, you moved on to Queens and then McGill.
Well, one of the reasons I went to Saskatchewan, I'd had job offers from BC as well and a couple of other places. One of the reasons I went to Saskatchewan was because they promised that I could get educational leave for both the arts and then the social work. Mm-hmm. So that I worked for a year full-time in Saskatchewan, and then summers for the period of the next number of years. Mm-hmm. In between university attendance.
If I might ask a little more detail about that educational leave, were they holding a job for you and putting you on partial salary or helping with your tuition? Or
there was an offer of that, and I preferred not to until I ran out of money in my last year at McGill. Mm-hmm. And then I wrote back and said, please enroll me in your... so it was just leave without pay. Uh-huh. And it wasn't a specific job being held for me. There were always staff shortages, and so when I go back in the summer, I would do whatever they decided I could usefully do. Mm-hmm. Perhaps I should tell you, in terms of pioneering social work, if you like, a little of what the situation was in Saskatchewan when I went there in '46.
I'd be very interested to hear that.
I think there were 3 or 4 social workers employed in the department. Marie Gelnap could probably tell you more precisely, but certainly there weren't many. The department had been created, I think, in '45, which brought together a number of things from a variety of different departments. Social assistance had been under the Department of Agriculture, I think, if I recall. Child welfare was under Department of Highways or something absolutely, totally unrelated at one point in time. Anyway, the department had been created, and a central structure, and there were regional offices. I think all the staff, or almost all the staff in the regional offices, were people who had, a few of them who'd worked in the old direct relief program during the 30s, a high proportion of them veterans who'd been recruited when they came back from the armed services. None of them, I think, with social work training. In many respects, a very good body of people. They worked as individuals who shared office facilities in a district office.
Mhm.
There was no there was no regional supervisory structure. They each individually reported to head office in Regina.
Mhm.
So the day after I arrived in Regina, I was told I'd share an office with another girl with whom I would be working, and so Elaine had an appointment with Keith Armstrong, who was director of child welfare, to discuss some cases with him. She said, "Why don't you come with me?" So he said, "Well, have you decided how you're going to divide the work?" I said, "No." He said, "Well, why? Let's just draw a line down through the center of the province. And Dorothy, you supervise the child welfare workers on the east side of the province, and Elaine, you supervise them on the west side of the province." I'd had my one little night course in social work and some experience. And Elaine had just some practical experience in the field, but we were the supervisors for family services for the province.
Very different than the way things are done today,
Very different.
wouldn't it?
Also, I was to be the intake worker immediately on arrival. So I would get into the midst of an interview and be asked a question about program and so on, and have to try to find someone who could answer the question for me, which was sometimes very difficult.
I imagine it would be. So, no orientation or
No orientation.
background
no.
reading at all.
You know, it was a very, very new situation with a department which was trying to get itself organized and develop a program of services covering the province.
In Saskatchewan, the CCF government had been elected, I think, in 1944.
That's right.
And was this burgeoning of services related to their interest in social welfare?
I think so. That it was the commitment of that government to the importance of services to people that formed the basis for, the decisions to establish the department in the first place, and to employ the best people they could find to advise them on how they would develop programs and a structure to provide services.
Things, though, were very different again, though, from what our current understanding is. In the reading that I've done, I understand that municipalities in Saskatchewan were responsible for social aid.
Oh, yes.
And were they involved in child welfare as well?
No, there were a few children's aid societies, one in Prince Albert and one in Moose Jaw, and there may have been one or two others. The last of those had folded or been closed out by the province, their charter withdrawn shortly before I went to Saskatchewan. So I really don't know very much about it.
So that wasn't the situation when...
No, when I went
you
there,
were
the department was responsible for child welfare services throughout the province. But the social assistance continued to be municipal for quite a long time after that.
So, during the next 10 years or so, you worked in child welfare almost exclusively, I understand. From my reading, there were a number of issues that, at least theoretically, from books were of concern. I wonder if I could get your impression on a couple of these issues. One was Native children, a second was residency requirements, and a third was religion. Were either of those or any of those three have any effect on you or your work?
Residency requirements, Saskatchewan decided very early, and I can't remember just when, that there wouldn't be any for services in child welfare. Assistance was a different matter, but for services in child welfare, they had dispensed with any residence requirement very early. Um, Religion, yes, was a problem in terms of finding homes for children, because always there was an inadequate supply of Roman Catholic homes.
Mhm.
So you were always trying to scramble to find either foster or adoption homes for the Catholic children. The question of native children, I don't think had been identified as an issue at that time. Certainly, we did have a good many native children in care. Although I think the proportion became higher later than it was, as I first recall. One of the real problems in Regina during the early part of that time was simply the sheer number of children that were there. Because with a very centralized system, which it was previously, whenever a regional worker couldn't locate a home for a child, because Regina was the center and because it did have a little more staff, those children were sent into Regina to be looked after, so that there really was an overloading of the potential resources of the city.
Yes, yes. And combined with that, the...
And usually the most difficult children, too, were the ones who were sent in to Regina.
because they would have had the most difficulty finding placements for
Yes.
them in their smaller
Mhm.
municipalities. Yeah. The issue of religion and native children, I understand that there could have been a relationship between those, that many of the Métis children were Roman Catholic.
That's true.
And perhaps the Métis children were overrepresented, or proportionately overrepresented.
Yes, on top of which the Métis families rarely had the resources to care for additional children themselves. Their own families were usually large, their incomes were low, and their housing was marginal, most
Mhm.
of them.
Mm-hmm.
So that, as a rule, Native families couldn't take on additional children.
Mhm.
There were exceptions. We had some really wonderful Native foster parents, but I would say it was the exception.
Mhm.
In a way, that the whole problem of Catholic homes was also was partly the same, because most Catholic families tended to have a larger number of children, so that they would feel less inclined or less able to care for additional children
Mm-hmm. Mm-hmm.
than the Protestant families.
So the problem was exacerbated then,
Mm-hmm.
in that way, yes. One of the things that I noted in the reading that was that regarding the department itself and the tremendous growth, that around the time 1955, 54 or so, the department had a staff of 600 with a turnover rate of about 30% per year. What was it like then, after you'd been in the department for 10 years or so? Had things improved from...
Oh, enormously, yeah. Staff to caseload ratios were very much better. They were still high. You know, we used to look at some of the non-governmental agencies elsewhere and think that people were terribly protected. And then the sheer problems of covering a large geographical area too, and managing to get around on roads that were off, and particularly in the early days where the roads were not very good. Large proportion of the years winter driving, and Saskatchewan had probably the most widely dispersed population over a rural area of any province in Canada, I think. And so there was that. I think some of the turnover things were, the department by that time was recruiting primarily, for beginning staff, primarily new graduates of universities. And some of these decided that social work was what they wanted. Some of them decided that it wasn't. Throughout those years, the ones who decided that social work was their career had to go somewhere outside the province to get social work education. And many of them, in the process of doing that, decided there were other places more attractive to be than Saskatchewan. So there was always that sort of fight or problem in retaining staff.
And that fits in with
It also fits in with this general sociological phenomena. Yes. Through most of those years, there was out-migration from Saskatchewan.
Yes, that was the very point I was going to bring out as well. As well, during that time, I understand that Saskatchewan and the other prairie provinces were undergoing massive development activities for highways, for electrification, very much a rapidly developing society. So a lot of things were happening all during this period.
It was a very exciting place to work during those years. Yes. And some of the most interesting people, that because the CCF was engaged in really what were social experiments on this continent, they attracted very able and interesting people to be advisors or early staff members of these programs.
Did you have contact with some of those people?
Some of them. Tommy Shayama, for one, whose name you may recognize. David Levin, who's now with the federal government here. Oh dear, it's a long time ago. David Caspegs, who was with the Power Corporation. Just a lot of people.
Were those people advising or involved in any of the department's activities or planning?
David Levin was. He was, for a period of time, Director of Research and Planning, and contributed a great deal, I think, to well, I think one of the positive functions he performed was questioning the things that the social workers and the staff said, and making sure that we had really thought through thoroughly what we were proposing. He has one of the best minds, I think, of anyone I've ever met. And he really made us do our homework, which also had political payoff, too, because when I was talking to Al Johnson, who used to be head of the Treasury Board here, and had been Deputy Minister of Finance, I think, in Saskatchewan, and one time he said, the Department of Welfare fared pretty well in the competition within Cabinet for budget because you'd always done your homework. And you didn't come out with some big global figure without very much to support it.
Yes.
And I think David had a lot of responsibility for that.
During that period of time, there were other people who I understand were working in the department in Saskatchewan. Names that come to mind are Alice Dales, Millie Battle, and others. Those people that you had contact with?
Oh, yes. Yes, worked very closely with them. During the period I was in child welfare, except for that first little bit where things were very unstructured. Millie was first assistant director and then director of child welfare. I just know she was supervisor. Took the first properly qualified person to take on the function that Elaine and I were trying to perform in that first year. And Al Alice Dales, well, she was sort of the conscience and the soul of the child welfare part of the department, I think, in a sense, because she just cared so much about children, and managed to imbue the staff with that kind of feeling that Keith Armstrong was also there when I first went, who was later with the Rehabilitation Council for the Disabled or something like that. Jack White was deputy minister. He was not a social worker. He was considered, I think, one of the exceptional deputy ministers, you know, in the Canadian context.
From your work in child welfare, then, oh no, I want to go back for just a second. During the time that you were in child welfare, you were also serving on the board of the Regina Welfare Council, is that right? Or were involved with them in some way?
I would have to check dates. I think it was later, after I was no longer in child welfare, that I was on the board of the Regina Welfare Council.
Yes, sometime during the 50s was, yes, what I was able to find. At that time, I understand the Welfare Council was involved in dispensing social aid. Were you at all involved in that kind of thing?
No, it wasn't.
No?
It was a planning, a community planning council. Much like the Social Planning Council of Ottawa, except it died later, but it was that kind of function. It wasn't in any way a direct service agency.
Okay. And sometime again during that period, you were an advisor to the Indian Métis Friendship Center. What kind of volunteer work was that, or was it volunteer? Were you?
Yes, it was volunteer. It was sporadic. There were a number of us that who were not on the board of the Friendship Center, but who had indicated that they could call on us for advice if they wanted on programs, on possible resources. And I suppose the major single thing I did was assist them in defining what they wanted in an executive director and then in the search for one.
So you were helping them write job descriptions and that sort of thing. From there, you moved into the area of public assistance, and from what your curriculum vitae shows, we were in the area of public assistance in Saskatchewan for around 12 years. First as assistant director.
First as a supervisor, actually.
First as a supervisor,
of the Disabled Persons Allowance Program, which had just been introduced.
That was a new program?
Brand new program. That's was probably on the missing page.
On the missing page of the curriculum vitae. In your work as in the public assistance division, as supervisor and then assistant director and then director, you were involved in development of some very interesting legislation. Some of the things that I see that you were involved in is first the development of the Social Aid Act.
It was a new Social Aid Act, yes. There was a previous one which spelled out that municipalities were responsible for providing social aid and said very little about what the program should be. It was mainly an authority. The department had developed some brochures that were supposed to help municipalities in deciding how to, how much assistance they would give to people, but I really don't know how much impact. I suppose they helped, but there was no teeth to them.
Mhm.
It was just advice, which they could follow or ignore as they chose.
Was that act provided guidelines or suggestions for municipalities? Was the province at all involved in paying for social aid?
Oh
That
yes, the
it
province had been involved in paying for social aid ever since the 30s, because most municipalities in Saskatchewan went bankrupt in the 30s. They didn't have any money.
Mhm.
And so the province and then the federal government in a number of those years in the 30s also helped with money for assistance. I think part of the time in the 30s, the province, subject to contributions from the federal government, paid the whole cost. Then they reduced it to 75%, and it was for a time 50% of the cost. Which I think is what it remained at. It was a sort of 50-50 sharing of the cost.
Did the province then not have the option to not cost share the costs of social aid of the municipality?
I suppose so, but when there have been no standards developed, on what basis would they refuse?
Mhm.
And who was it going to help if they refused?
Mhm. Mhm. So the new act, the new Social Aid Act, which you were involved in the development of, did that improve things?
Oh, greatly, yes. And that started with our then Minister of Welfare, who was really very outstanding man, Mr. Tom Bentley, who spoke to each of the annual meetings of each of the municipal associations. There were two associations, a rural association and an urban association, and suggested that there were a lot of problems in the administration of assistance in Saskatchewan, that he thought if we would put our heads together, we could come up with a great deal better system. And so he invited the associations to nominate representatives to work with officials in the department to develop proposals for new legislation, which is what happened. Mm-hmm. And they came up with a document which was entitled the Social Aid Survey, which formed the basis for new legislation in 1959. Mm-hmm. No, I'm wrong about the title, but they did come up with recommendations for the Social Aid Survey document was a later one. But they developed recommendations for the new legislation in 59, mm-hmm. which one of the major achievements was that it developed a new cost-sharing formula and did away with any requirement for residence as an eligibility requirement for assistance.
In doing away with the residency requirement, would that have been doing away with municipal residents?
Municipal and provincial.
And provincial. So
residence was defined as physically present. So if you were there, you were resident.
That's a very broad definition.
Yeah.
Yes, indeed, that would be quite an achievement. Saskatchewan was so far in the forefront of development of social welfare. I wonder if there had been any discussion at that time of anything like a guaranteed annual income or anything like that sort of idea.
No, not really, not that early.
Mm-hmm.
You know, we were trying to achieve a decent level of income administered in a way that would protect the dignity of people to an extent that didn't occur when, under municipal assistance, people might have to appear before a council meeting to ask for assistance, or to justify their need for assistance was one of the things that sometimes happened.
They'd have to appear before a public meeting of municipal council to
mm-hmm.
request aid.
Yes.
Mm-hmm.
And I'm sure that occurred in other places in Canada as well. Saskatchewan, I think, had a particular problem because they had so many small municipalities, you know. I think there were around 800 municipal units in the province. So that most of them were really too small to have any specialized staff. Municipal secretary treasurer, and many of them was the only full-time staff, and then they had people who worked on roads and, you know, some other things. But
in some provinces, the RCMP had been assigned responsibility for deciding eligibility for social aid and dispensing it. Did that happen in Saskatchewan, to your knowledge?
not to my knowledge, and I don't think so. I think they sometimes perform child protection functions, but I'm not even positive about that.
Mm-hmm.
They might have, possibly, in the far northern part of the province, which was unorganized, and you know, I presume they would use whoever was available to perform.
To do that, yeah. A number of other things happened during the years that you were assistant director and director of public assistance. One of which was the doctor's strike in 1961, an election in 1960 fought on the basis of Medicare. From your view as an administrator of a provincial program, were those things affecting you in your work?
Not greatly in my work. There had really been no problems in terms of doctors providing health services to the people for whom we, in conjunction with the Department of Public Health, provided health services. They were quite, I think, quite satisfied with those arrangements, so far as I'm aware. The concern during the doctor's strike was more really the general population. It was the only time I can recall among a group of friends in Regina that there was a topic we couldn't talk about. Because people felt so strongly.
Too hot to discuss. Yeah. I understand that many of the community groups across the province mobilized, and there were marches and demonstrations and motorcades,
yes.
and public opinion ran high on that.
Oh yes, and also that was when a number of the community clinics were organized, and they brought in doctors from Britain mainly to staff community clinics.
And how was that kind of a concept received in the communities?
Not well by the medical profession, because
No.
these doctors would be on salary, which was a precedent that they weren't anxious to have sat. And I think there was controversy in the community with regard to them. There were people who were strongly pro-community clinic, and others who were either anti or disinterested.
Mm-hmm. At that time, Mrs. Zarsky, was there any connection being made in thinking about universal medical services and universal access to social services or universal social aid?
In terms of a guaranteed income, no. In terms of access of anyone who needed it, that was a principle that had been established in the assistance program in the 1959 legislation.
Mm-hmm.
Adequacy was another matter, but although we tried, and I think some of the things that were part of that development were what were the relationships between the more of the administrative techniques of how people would get service, so that in the process of people receiving health services, they would not be identified as welfare recipients, and that involves working out of some tricky techniques so that at least the possibility of identification was minimized.
I understand that shortly after, a couple of years after the doctor's strike, that there was a move on in the province to institute work for welfare, work for aid.
Yeah, there'd been a change of government in the meantime.
Oh, had there?
Yes, the CCF had been defeated by the Liberals. And they came in with an idea that that the welfare system had gotten out of hand, that it needed to be curtailed. And the minister of welfare was a Mennonite farmer who had a very strong work ethic sort of point of view. A very good, but, you know, in terms of his own experience, a limited man. And he thought that work for assistance would be a very sensible kind of a policy. And I think what Art Savon, who was director at that time, and I did, was the kind of thing that I would hope that public servants might do in relation to the political head. Instead of trying to convince the minister, or tell him that he was totally wrong, we did identify some of the problems, but then we also talked with him about why he wanted it, what he hoped to achieve by it, and develop proposals for a work activity program, which in part related to his underlying objectives, but which instead of being a negative and controlling kind of thing for recipients, we hope would provide opportunities for those who had long-term unemployment and no skills and so on, to an avenue into the labor force.
So part of the way that you saw your role as a public servant then was to broaden the horizons of the elected officials and present a range of alternatives for them to consider.
That's
in
right.
Their
Yes.
was that minister, Mr. Bolt?
That's right.
Is that the same man who, at some time, started an inquiry into public assistance? Was the work for aid and the inquiry part of the same process?
No. They converged in that the work activity became part of a new piece of legislation. But the Liberal government did say that, well, as I mentioned, they said they wanted to bring the welfare system under control. So it was agreed that there would be a review. Oh, they wanted to also change the formula for cost sharing with the municipalities, which had been established in the '59 Act, under which that was an important milestone, I think, because the formula, the cost-sharing formula, was what made it possible for us to get rid of the residence requirement. Because instead of each municipality being directly responsible for the municipal portion of the assistance issued to people who were their residents, even if they were no longer living there, but legally their residents, that act provided that the municipal share of the total social aid bill for the province would be a certain percentage which would be adjusted according to the formula and would be distributed among the municipalities on a per capita population assessment, which varied with the size of the villages, towns, RMs, and cities each had a different initial per capita rate. And the assessment, as the total expenditure changed from the base year, then the actual levy would change, but the formula was retained, and this meant that municipalities would not be faced with overwhelming costs for assistance, and they could budget for the amount that they would have to expend. The department sent them an estimate at the beginning of each year that they could work into their budget of what their levy for the year would be.
And this is in relation to the 1959
That's the
Social Aid Act.
59.
Yes.
And the Liberals wanted to change that arrangement, among other things, to expect municipalities to pay more of the cost. And so the two municipal associations also were objecting to drastic changes in the program. And so the government agreed that before they introduced any new legislation, there would be a joint federal-provincial study of the program, which would produce recommendations for new legislation.
You said federal, provincial, perhaps
Provincial
municipal?
Provincial municipal, I mean, yes. I'm sorry.
So the fact or the announcement that there was going to be an inquiry into public assistance wasn't a surprise.
No.
For you.
No.
Yeah.
No, because the party had said that that they wanted to make changes, and so the decision to carry out the study was recommended jointly by both by officials in the department and by officials of the municipal association.
And I think that by that time, or shortly thereafter, you became the director of public assistance, and were probably instrumental in the development of the new act. Could you describe
Pretty
what
largely.
happened?
Could I go back a moment?
Sure.
Because I think it's something that is very important for the practice and the development of social work and social programs, that the reason we had an opportunity to develop good legislation at that point in time was because we had worked with the municipal representatives over quite a period of years. And we had annual meetings where we developed the 59 legislation in conjunction with that. And then we had at least annual meetings to review it and plan with regard to any changes. So that the municipal associations and representatives of various municipalities felt it was a program they had a stake in. And it's a courageous provincial government which will antagonize its municipal associations. So, and I think we don't often enough look at who are our allies and develop relationships with them, or our potential allies.
So are you saying then that social work has an air of the political as well as the altruistic?
Oh, sure. If at least in public programs, you have to be aware of the political realities. I think if you hope to get approval for the kind of programs you think are important.
Before I go on to the development of the Saskatchewan Assistance Plan, perhaps I too might go back for just a second and mention that the Saskatchewan Association of Social Workers was established in 1962, and wondering if you had had any involvement with that association over the years, your years in Saskatchewan.
Well, I was a member from the time I went back when I was in. The Provincial Association was established in '62, but there were branches of CASW, various places in the province before that.
Yes.
And so I'd been a member of CASW, which, when I was first there involved driving 125 miles from Prince Albert to Saskatoon to attend a meeting if I wanted to go, and back.
And back.
And back. Anyway, no, I didn't. I was also president of the Regina branch for a period of time, but I think that was before the Provincial Association was formed.
Mm-hmm.
I didn't have any great role in that.
Mm-hmm.
You know, it was something that the individual branches had decided that the time had come, that there were enough social workers and enough branches that it made sense to have a provincial association instead of each branch relating to the Canadian Association.
Mm-hmm.
I think there was also looking ahead toward opportunities to regulate practice.
Mm-hmm. Which indeed came about with 1967, I think it was, a passage of legislation. During these developments in social assistance in Saskatchewan, were the professional associations involved as support lobby groups? Were there others involved in other third-party groups who were trying to help make things better?
In the early years, the professional association not much, because the social workers were largely concentrated in child welfare. I was the first social worker in the province ever to work in public assistance, I think, and some of my colleagues really questioned my decision to move into public assistance.
Why did they question that decision?
Well, I think they felt that social workers should be more concerned with family relationships and services than with the financial assistance programs. I'm really not sure, but.
Well, that's an interesting observation, because for many years there had been a push by some social workers, at least, to professionalize social assistance and public administration.
How early?
Oh, 1929, 1935, 1945.
Yeah, earlier, yeah.
I'm wondering if there were cycles.
There was that in the States, I know. I'm not sure there was so much in Canada during those years.
I'm not sure. I understand that Charlotte Whitten was a strong advocate of professional social workers doing relief, but
that may well be. And of course, in Quebec, it was the social agencies in the church who actually administered relief.
Mm-hmm.
And certainly the Marsh report in BC had looked at that whole area.
Mm-hmm. Mm-hmm.
I think probably it was more a matter of priorities, that there weren't very many social workers, and one placed them where you thought the need was most crucial for professional competence.
Mm-hmm.
And the feeling was that one could staff assistance services quite reasonably by people who were not social workers.
Mm-hmm.
I'd be inclined to think that in part that may still be true, because watching the involvement in the department, and inevitably the administration of assistance involves a lot of functions that are routine, that are calculation of amounts of assistance, application of rules, and this kind of thing. That in my experience, social workers don't like. They don't do very well, by and large. It's a real conflict of roles, I think, for most, because what they want to do is be out there helping people with their problems. Now, it's true that they recognize that the money helps, but most of the things they're actually doing don't bear much relationship to what are their personal objectives. And because of it, they often don't do the job well. Which is why, at a later date in Saskatchewan, they suggested that while there should be services associated with assistance, there should be some separation of function.
And that's an argument or discussion anyway
Which is
that's
still going
continued
on.
Yes, indeed. To go back then to your work as director of public assistance, you were again involved in developing major legislation for Saskatchewan through the Saskatchewan Assistance Plan. What happened there? Were you trying to do something different than with the Social Aid Act?
Well, this arose out of the Liberals' decision to review the program, remember, and we talked about in that inquiry, which turned out to be a very broad, far-ranging study of the totality. It considered objectives for a total assistance program for Saskatchewan, not just social aid, because they came to the conclusion that the categorical allowances, you know, old age assistance, blind person's allowance, disabled person's allowance, and so on, should eventually be merged into an overall assistance program. But that social aid study formed the basis for the Saskatchewan Assistance Plan legislation.
Were there major differences in this legislation from the Social Aid Act, residency, eligibility?
Those kinds of things were retained, but there was more definition of, well, more recognition, first of all, that all these hundreds of little small municipalities could not implement a program which considered that it included a service function. That there was just no way that a man who was a secretary-treasurer of a municipality was going to be able to provide social services to people. So that included in that act was a provision for total reorganization of the provision of assistance in the province. It still included a place for municipal administration, providing the size of population and resources and caseload were such that the municipal unit would be able to meet the minimum standards of service that were defined in the Act. And it included a provision that municipalities could do this collectively, which would get around the smallness of the geographical areas. That they could agree to associate. In fact, only 2 places in Saskatchewan did that happen.
Where was that?
Prince Albert and Moose Jaw. It's the tape.
Mrs. Zarsky, we were talking about the Saskatchewan Assistance Plan, and I understand that it combined the existing categorical programs as well as allowing municipalities to opt out of social aid. The Act was implemented, I understand, before the Canada Assistance Plan began, although the Canada Assistance Plan was at that time under development and about to be adopted.
Well, what we did was in law, we provided for the categorical programs to be merged into the Saskatchewan Assistance Plan, but deferred implementing that part of it until the Canada Assistance Plan was passed.
So that would allow you to
continue to administer the categorical programs until we could get cost sharing for them under the Canada Assistance Plan.
So you sort of knew what was going to happen with CAP?
Yes, there'd been enough discussions federally, provincially, to know that probably, at least, CAP would allow the provinces to cease administering the categorical program.
Were there some political reasons for urgency in getting that act passed, the Saskatchewan Assistance Plan? I have read that the premier of the day of the province was not particularly supportive of changes.
I'm not sure. It was sometimes hard to tell what the premier. Well, he was very vocal about some of his opinions, but in terms of a public servant and consulting with the premier, one had to take new proposals to Treasury Board, which was a committee of ministers, but very often was simply the premier by himself. And I can remember when we went with the Saskatchewan Assistance Plan, we initially went in, and he said, "You can have 5 minutes."
This was
which was typical Ross Thatcher, that he couldn't spare any more of his time than that to discuss a big new program. We ended up, I think, with 20, but which was some kind of record, maybe. And sure, he had a lot of questions. Some of the things he would not agree to allow the number of staff that we said were necessary to implement the plan. In that area, he was not very supportive. But he did say that, well, introduce it if it won't work with the level of staffing that I'm agreeing to, come back next year. There was a commitment, you see, that they were going to do something. There'd been a lot of effort put into this review, which had had a fairly high profile in the province, so that I think it seemed important to go ahead. And then there was the reasonable expectation that the federal legislation was going to be changed anyway, which provided an opportunity to do things that we'd been wanting to do for a long time, and which really had not been possible under the previous legislation. Could I add something? It's just a nice little. Several years earlier, well, the CCF had still been in power. There were periodic meetings of federal and provincial ministers, and there was a term for it under the categorical legislation. It was a particular kind of board. And we were identifying so many problems with having so many different programs with different eligibility requirements that within the province we had decided there should be a single program, that you didn't have to put people through several hoops in order to manage to meet what were their needs. So our minister at one of these meetings had tried to raise the question of why did there have to be so many programs? Why didn't we move toward a single one? And the Honorable Paul Martin ruled him out of order because it didn't fit into the prescribed function of this particular board for a categorical program. But then Mr. Martin was called out of the room for something rather, I don't know what, and in his absence, Mr. Bentley managed to say what he'd wanted to say.
It's an indicator of how things were discussed federally and provincially, and how things got on the agenda. Following the implementation of the Saskatchewan Assistance Plan, you continued to work in Saskatchewan for some period of time. Things changed, though, with the implementation of that plan. Did they change for you as well as for the department?
Not immediately. Well, the process itself was interesting. For me, you know, I'd never before gone through the business of working with the Legislative Council on, I'd worked with our own departmental solicitor in trying to come up with legal phrasing for what was intended to be a social program. But then the process with the Legislative Council was a rather enlightening experience. It was very difficult to get him to agree to use wording that hadn't been used in previous legislation, And if you're wanting to do something new, that's a real problem. But his point, which had, considerable validity, was he said if you use wording that's been used before, you know how it's going to be interpreted. If you start out with new wording in a law, you don't know how it's going to end up being interpreted.
Mm-hmm.
Anyway, there was that process, and then the process of being advisor to the minister when the legislation was introduced in the House. And it was an interesting exercise.
It must have been an exciting time. Was there opposition to the legislation?
Not greatly, because you see, it incorporated, it was sort of a reverse of one, because it was the kind of legislation that the CCF might well have introduced, although it was being introduced by the Liberals, so that the opposition was very supportive of the legislation.
Mm-hmm. Mm-hmm. And community groups or the anti-poverty organization or any of that kind of thing?
At that point, I don't think there were any anti-poverty organizations as such. Groups like the Regina Welfare Council, for example, and the people in the non-governmental agencies were certainly supportive of.
Mm-hmm. I wonder if I might ask a more general question, which relates to that I've just asked, regarding how social change came about during that period in Saskatchewan. Was it a matter of negotiation, or perhaps not negotiation, communication between political parties and with the public servants involved, of course? Or were there third parties involved? Were there lobby groups at all?
Not a great many, no. The important, there were, I think, with regard to child welfare services, there were groups who were more, but in the assistance field, it really was the municipalities, the public servants, and the political parties. Mm-hmm. That they were the prime actors.
Mm-hmm. So, representative democracy was the way that things were done.
There were also things that the Canadian Welfare Council had produced, in terms of standards in recommended standards of assistance. There was, over a period of years, the Canadian Welfare Council produced a number of papers on assistance, and I think those probably had some effect.
That material, though, if I'm interpreting what you're saying correctly, perhaps would have been used by public servants more than it would have been used.
More than by community groups.
Used as ammunition for someone to.
Community groups were also very much involved in the nursing homes for special care program. That was one departmental program that community groups were very actively involved in. But I think assistance was seen as a governmental function. And I suppose the one group who really probably would have been interested in saying something to government with regard to it, they had really no voice. It was the people who were poor.
Themselves. So the people who were concerned about the adequacy of assistance rates, for example, would have been the public servants, the politicians, and of course,
so.
The individuals themselves. But as you say, they had no voice.
I think some of the churches probably had concern, but I don't recall specific representations.
Yeah, thank you. That helps my understanding of how social change came about in Saskatchewan during that period of time.
Partly, I think one has to see in the fact that Saskatchewan was so very rural, too.
And the province had indeed, and I think continued to be in the forefront of social welfare developments across the country, even at that time.
I think
Yeah.
perhaps in a way that hasn't always happened in other provinces, the people of Saskatchewan saw the provincial government as their instrument. Particularly during the early years, I think, of the CCF, that they had elected these people to produce changes in society because they'd been through a very traumatic period, and so that the provincial government, which the Cooperative Commonwealth Federation, which I think was a name that related more to the experience in Saskatchewan. Cooperatives, too. They use cooperatives a great deal for many things. Consumer cooperatives, producer cooperatives, credit unions, all that kind of thing. So that more than in some other provinces, I think, that people felt a personal interest in the government and that the government was really acting for them.
That is indeed a very different concept than is often reflected, that government is a servant of the people rather than the other way around. You shortly thereafter left Saskatchewan and came to Ottawa. May I ask how that transition came about?
Yes, actually I had been asked to consider a job in Ottawa in about 1962, I think. And at that time, my husband and I came to Ottawa and talked with people about it. And he looked to see what he could do here. And there were openings with energy, mines, and resources in the technical surveys branch. But he'd have had to spend about 8 months of the year up in the Northwest Territories, and we didn't think we wanted to live that way. So, and then after he was forced to retire for health reasons, the people with the Canada Assistance Plan, well, actually it was the ADM to whom the director of the Canada Assistance Plan reported, asked me whether I would reconsider. And so I decided that I was beginning a little to feel in Saskatchewan like a senior citizen, and I wasn't sure whether I was ready to be that yet.
Because you certainly weren't.
No. But I'd been there, for a long time, and I'd been involved in so many of the things that had been developed in Saskatchewan that the staff tended to see me as having been there forever,
Who was the assistant deputy minister at that time?
Dick Splain, Dr. Splain, who's now out with UBC.
So Dick asked if you would come to Ottawa, and you decided that you would. Over the period of time that you were working under the Canada Assistance Plan Directorate, or perhaps beginning even slightly before, poverty was discovered or rediscovered as a national issue in the country. A number of things happened during those years, and I want to just list them and then ask about your work and your relationship to those events. In 1968, there was an Economic Council report on poverty. 1969, Canadian Council on Social Development report on social problems and poverty. 1979, the report of the Royal Commission on the Status of Women, which had some recommendations regarding poverty. 1971, the report of the Kroll Senate Committee on Poverty, and following that, the report of the Real Poverty Report. And then the Castonguay-Nepveux report, also in 1971. All of those things had to do with poverty, and you were working in the directorate, which had the responsibility to deal with that in the country. What was happening for you when all of these things were coming about?
Occasionally, there would be staff people associated with these activities who would come and ask for information. There was another one in there that Dr. Willard, who was deputy minister, did a major report on Social Security for Canada in about 70, 71, which should perhaps be part of that general list. On that one, because he was working on it and developing recommendations about the time I moved to Ottawa, I was asked for my opinion on terms of how practical some of the things he was suggesting were. How, you know, how would they work when you got down to really to the level of deciding who gets benefits and who doesn't, and this kind of thing.
Mm-hmm. That paper, I understand, proposed that the family allowance and youth allowance programs be eliminated and replaced with a family benefits plan, which was related to income, called the Family Income Security Program. Why was it that let me rephrase that. To eliminate the family allowance and youth allowance programs were two very important universal programs. Why would the government, do you think, want to eliminate those universal programs?
Well, I think the concern really was, if you're concerned with poverty, one worries about the leakage, in a sense, in universal programs in terms of benefits going to people who have really entirely adequate incomes. And if you have a given amount of money to spend and the need probably exceeds the resources, then you want to look at better targeting of how those resources are spent.
Mm-hmm.
So that I think that was the impetus behind it.
Mm-hmm. At the same time, or again around the same time, there were two proposals for a guaranteed annual income. Had there been discussion, at least as far as you were aware, in the federal government about a guaranteed annual income?
It wasn't described in quite that way, but I think it was certainly one of the options, I think, that Dr. Willard considered in his review. And, you know, questions of a guaranteed annual income were certainly discussed, but I'm not sure they were discussed in terms of serious policy prior to the much later Social Security review.
Mm-hmm. That which occurred several years
Mm-hmm.
later. Mm-hmm. But the idea was percolating around
yes.
the country.
Mm-hmm.
Mm-hmm. Another thing that happened at that time, which I'm not sure that it's closely related to the topic of income security, but was the Constitutional Conference that took place in Victoria in 1971. Social security issues were discussed at that conference.
And the conference founded partly on the issue of Social Security.
Indeed it did. Was there discussion within the department at that time about that?
Yes, yes, there was discussion of the proposals that the federal government would make to the provincial premiers, and of the positions that the federal government would take with regard to that. And some of the staff of the division were there. I was not, but some of the staff of the division were there as part of the group of federal advisors.
They were at the Victoria Conference. Mm-hmm. I think it's an interesting fact that the Constitution, which we so recently acquired in Canada, we had a chance to have one before in 1971, and yet because of differences between governments about Social Security, we lost an opportunity to obtain our own Constitution. Following these developments, there was a federal election, which resulted in a Liberal minority. Did that in any way, in your mind, affect the kickoff of the Social Security Review in 1973?
I'm not sure. I hadn't thought of it before. I didn't have the impression that it did.
Mm-hmm. What was the Social Security review, and how did it get going?
Well, there'd been the ferment within the country, not only within the social services community. I think some of the economic prestigious agencies have been saying that our welfare system is in a mess. We have overlapping administrations. There are just a lot of things wrong with it, and something should be done about it. And apparently, Cabinet made a decision that they wanted to. And I think there'd also been representations from the provinces. There were urgings from the council as well. They had developed a review of Social Security and social services sometime around that time too.
The Canadian Council on Social Development, yes.
So that there were a lot of inputs, I think, and just how the decision in Cabinet came about, I'm really not quite sure. But when Al Johnson was appointed Deputy Minister and Lalonde as Minister, clearly they came in with a mandate to re-examine and to develop a new Social Security system for Canada.
I understand that they started off the review by tripling family allowance payments. That's a pretty drastic change from what they had tried to do 3 years before, when they had said they were going to eliminate family allowances.
Part of that, I think, was in response to the enormous reaction they got when they were proposing to eliminate them. There really was a lot of opposition to that, particularly from women's groups. So that the eliminating of them, I think, was abandoned. If you were going to retain them, if there was any logic to family allowances at all, it really didn't make sense to leave the rates where they had been. I'm not sure how many years before, but there had been very little adjustment in the rates of family allowances since they were first introduced, and they were way behind the adjustments, the rate of inflation. I think there was also some feeling that family allowances might form one block in a guaranteed income structure. Because if you look at the problem of poverty, one of the largest contributing factors to poverty is size of family. It also presents problems for assistance programs and for unemployment insurance, particularly for assistance programs, because if you're going to provide a level of assistance that is adequate for a given size of family, if the family is more than just a very small family, it's likely that you're going to be providing a higher level of income than many of the recipients are going to be able to earn when they're in the labor force. So that if you have a level of family allowances that goes some fair distance to meeting the costs of child rearing, that becomes less of a problem.
So, do you see that there was a change in philosophy or approach then, from 1970 to 73, with the change in family allowance? Or
I think it was probably more a recognition of a political reality. So, having recognized the political reality, then you look at how you can fit that into a total approach.
During the time that the Social Security Review was going on, which was about 1973 to 1976, For a good part of that time, you were Director of Welfare Services for the Canada Assistance Plan. What were your responsibilities there, and were they at all affected or questioned by what was happening during the review?
Well, I was responsible essentially for two things: supervising the provision of consulting services to the provinces, which mainly the provinces with less resources themselves made use of. The other was making decisions about what was eligible for cost sharing under the welfare services provisions of the Canada Assistance Plan. And the impact of the Social Security review was really, I was going to say twofold, but maybe I better not get into numbers because I might not find it right. First of all, I and some of the others of the staff were involved in the process of the review itself. There was a federal provincial task force that was set up to develop proposals for social services within the new structure.
Excuse me. This is social services as distinct from social assistance.
Yes, although it was proposed that the changes in federal legislation arising from the Social Security review would deal with federal support of services as well as assistance.
Okay.
So it was, the task force was responsible for trying to develop proposals to be considered by the Conference of Deputy Ministers for the content of the social services legislation.
Mm-hmm.
So I was a member of that body.
Mm-hmm.
But at the same time, you know, in the process of making decisions on eligibility of programs and services under the Canada Assistance Plan, in some respects, the Social Security review caused what had been a very expansionary climate federally, provincially, to grind to a halt, because CAP officials from the time the legislation was enacted had been really very actively promoting the use of the legislation to help finance better assistance programs and expansion of services. And they'd been doing that in their meetings with provincial officials. They'd been meeting with non-governmental agencies to talk about what the plan had to offer, providing they could work out agreements with the provinces. So that it had been very much a promotional, and then with the Social Security review, it sort of froze things for a period of about 3 years. And the promotional activity just ground to a halt. And in terms of decision making, it was terribly difficult, because you had to make decisions, in a sense, on the basis of explicit criteria and a hidden agenda of whether you were setting precedents that wouldn't fit into the new scheme.
Mm-hmm. That must have been very challenging for you.
It was very difficult.
Yes, yes. On what basis would one make decisions in that climate?
Well, basically, you still made decisions on the basis of what the law allowed. But instead of trying to stretch the provisions of the law to, you know, as far as one could legitimately under it, one tended to be a little more conservative as to, because sharing on the basis of services to persons in need or likely to be in need, which is what Canada Assistance Plan provided for, was a very different basis of service provision from what was being provision in accessibility to services particularly, from what was being talked about in terms of new legislation.
What was being discussed at that time as a possibility?
Well, a variety of techniques with, depending on, for different kinds of services, it was suggested that without any test except the need for the service. Others, it was suggested that they should be subject to contributions from the users, which would be the amount of the contribution being determined on possibly an income test, a means test, or, but this one nobody wanted very much, the needs test, which we were already using. And those kinds of tests produce quite different results sometimes.
Mm-hmm.
The other thing, the likelihood of need, that was persons who are likely to become in need. That's a very difficult thing to try to interpret and make decisions on. You know, what kind of criteria do you use? Income level, which is just about the poverty line, perhaps. Certain kinds of social problems, maybe. You know, who is likely to become in need if they don't get a service?
Mm-hmm. And were those definitions spelled out in regulation?
That one, not really. It just repeated the wording of the Act itself. Welfare, what were welfare services were spelled out in greater detail in the regulations, but the concept of what a test of need was spelled out in the regulations. But who was likely to become in need really wasn't.
So the decision-making that you would have been doing during that time on that particular issue, for example, likelihood of need, how would you do that?
You do it on the basis of program definition and how they would decide under the program or an agency's services, how they decide who is eligible for the service. And in some cases, it was necessary to say to the province, yes, the program is eligible, and some of the people who use the program are probably eligible, but you are going to have to work out techniques for deciding for which people the services will be shareable and which ones won't be, and we will monitor those techniques.
Mm-hmm. I'm not sure if this is an example which would relate to this question, so if I'm off base here, please tell me so. But the issue of services for women who have been raped, for example, and whether they should be anonymous, whether they should be needs or means tested, whether the fact of a rape or the possibility of a rape would make them likely to be in need of services. Would that be the kind of question that you would have to deal with?
It would be the kind of question. I don't recall that particular one ever having come up because I think those services sort of came along later in the main. But that would be the kind of question, yes. The other questions are single parent families per se likely to become in need? Or are they only, you know, if the income level is low, or if, depending on size of family, of skills of the single parent, you know.
What I'm observing is that in our conversation we've come a tremendous distance in time from 1946 to what we're talking about, 1975 here or so, 1973. Distance in time, distance geographically from Saskatchewan to Ottawa, but distance in perception of problems too.
Oh yes, tremendous.
In 1946, someone was in need if they didn't have enough money. Now we're talking about single parents, which as a concept probably was not nearly as common in 1946 as it was in 1973.
No, although it's interesting that Mother's Allowance program started back in 1916.
Yes, yes, that's true. Very early. Because I'm seeing an evolution and development of social welfare in Canada that's been being illustrated by your career and how you have moved from local child welfare work to federal policy, actually. To go back a little more specifically to the Social Security review, did you continue on as the in that position as Director of Welfare Services as the review finished? Where were you when that was winding down?
I think I retired about that time. I was director. While I was Director of Welfare Services, I was also attending the meetings of ministers of welfare across Canada. You know, it was part of the Social Security review, as well as working in the task force. But see, I retired at the end of '75, and then I worked for another 14 months on contract as a consultant on the development of the proposed Social Service Act, which is an outgrowth of the review. And the people who were working on the economic proposals of that review were also still working on it. So I think I really retired before it was completed.
During your work as a consultant on the new legislation, did you work on both pieces of legislation?
No, only the social services. I was also, the deputy minister had a committee to which both parts of it reported, and I was a member of that committee, so that I heard and sometimes had the opportunity to comment on what the people who were dealing with the economic aspects of the review were proposing.
In your work on the development of the Social Services Act, which was cost sharing, I understand, for a wider range of services than were allowable under the Canada Assistance Plan, were there similarities between what was happening there and what had happened with, for example, the development of the Saskatchewan Assistance Plan, with what had happened with CAP, with what was happening now? Did you see any kind of continuity there?
There was continuity in terms of progression of stages in how people perceived and the kind of services which had been developed in Canada. That there was that kind of continuity. The thing that was really different, in part at least, was that at the time of the development of the Canada Assistance Plan, and in general in the day-to-day working relationships too, in the main, it wasn't a we-they kind of relationship that it seemed to me developed later, but it was a we, that we were all in this task together of trying to achieve objectives of better programs. Over the years, in a variety of ways, it seemed to me more conflictual or I'm having difficulty confrontation situation developed, and people would talk about the feds, for example, which I don't recall that term coming up at the earlier date. And now, of course, the scope of the Social Security review was much wider than the Canada Assistance Plan had been, and that was probably part of it. It may have been the individuals who were involved. I felt that the expectations of some of the provincial officials were absolutely unrealistic. That they wanted unconditional grants with no ceiling. And it seemed to me that they were going to have to choose. Either there would be cost sharing, which would be percentage, or there would be unconditional grants with some kind of ceiling. There was no way the federal government would say you can spend whatever you want and we'll contribute to it.
Mm-hmm.
And certain provincial officials seemed to be very unrealistic and I felt that some of the reactions of the federal minister were frustration
Mm-hmm.
with these kinds of expectations.
Mm-hmm. You mentioned a minute ago that you wondered if the scope of the Social Security review was partially due to some of the people who were involved in it. Were those the people in your department? Anyone that you can
Oh, I
name,
wasn't
that you would name?
saying the scope, but I was talking about the changed relationships federally, provincially, were probably partly a matter of personalities.
I see. I see. Between public officials or between
Public officials and politicians.
Mm-hmm. And we're I've forgotten now who was deputy minister and assistant deputy minister during that time.
Al Johnson was deputy minister federally.
Mm-hmm.
Brian Iverson was one deputy minister who was much involved, and Russ Robinson another.
Mm-hmm.
I guess those were the two that had primarily involved.
Mm-hmm. And were you working with them as you were making your contribution on the development and exploration of the Social Services Act?
Well, as I said, I was a part of this deputy ministers committee
Mm-hmm.
that met on a regular basis to take a look at the proposals that were being developed.
Mm-hmm.
Otherwise, I was an advisor to the group within the Program Planning and Evaluation Division who were trying to take the general ideas that had been agreed upon by the ministers and put them into a pre-legislative kind of framework.
Mm-hmm.
You know, they would still have had to go to the legal people, but they were trying to get down on paper exactly what this legislation would say, and I think maybe, and this would be another difference with CAP, I think perhaps, and perhaps partly as a reaction to this feeling that the provinces were being unrealistic, that I think they were trying to specify too much. If you've ever looked at the Canada Assistance Plan Act, it's a fairly general piece of legislation which provides authority to do certain kinds of things without a great deal of detail. And in the new legislation, they were trying to, seemed to me, to dot every I and cross every T, and I don't think when you have two parties working a thing that you can do it that way.
That's one of the comments that I read about why the act was withdrawn, was because of the specificity or the attempt at specificity and the inability to do it, because there was just too much to be specific about. Shortly thereafter, after the Social Security Act or Social Services Act was withdrawn, the Social Services Financing Act was introduced, which was block funding for social services. I think that's a reflection of what you were saying about unconditional grants with a ceiling. Were you involved in that one at all?
Not really. I knew what, and it wasn't really for social services mainly, was it? It was for institutional care, wasn't it?
Well, I'm not sure. That was not my understanding, but I'm not
I may
an
be
expert.
wrong because I've been out of touch, but I think social services are still being shared under CAP.
At this time?
I think so.
Yes, indeed. What happened with this second act is that it too was withdrawn in 1978.
Yeah.
And there have been no major
Yes,
changes
I've forgotten that.
to CAP after that.
Except that the component that was nursing homes, which was part of CAP, I think that did become part of the established programs financing, did it not?
Yes.
Mhm.
Yes, which was again, another separate act. I wonder if I might move now, as we come to near the ending of our time together, to a couple of general questions that relate to your experience in public assistance and Social Security. I guess first of all is that there have been continuing discussions about the effectiveness of public assistance as a means of fighting poverty. Do you think that continuing social assistance payments is going to make much difference in that fight?
No, I don't think it's even designed really to do that. It's designed to keep people out of the worst kinds of poverty, to provide a final safety net, and that's all it does. It doesn't. It's not a good instrument for overcoming poverty in the country. It's a safety net for the people who have no other resource.
Mm-hmm. Mm-hmm. So during the years that you worked in that area,
a guaranteed income might be a major instrument in fighting poverty, I think.
You say might. Do you have? Are you suggesting that, or do you have reservations about that as a means to accomplish that?
I suppose the way I phrase that reflects the frustration I felt sometimes at some of the theoretical models that the people in the Russ Robinson's plans, the planning branch, were coming up with for guaranteed income. And it sounds so simple, and it's really an exceedingly complex thing to devise a really good guaranteed income plan.
Mm-hmm. Mm-hmm.
So that's why the might.
Do you have any plans to do any more consulting work that you can give them some advice on how to do it better?
I'd be interested in doing it, but it seemed to me the last few years everybody's budget has been cut so much that there hasn't been all that much in the way of resources for employing outside consultants.
Maybe just as the last question, Mrs. Zarsky, any comments you'd make about the changes that you've seen in social welfare over the years? Maybe the most significant developments, or the developments that are closest to the top of your thought.
Well, I suppose the most striking one is the professionalization of social programs of one kind or another. I don't know that I would talk about the shift from volunteers to employed, because I think that took place largely earlier. And volunteers in different kinds of roles. But the change from considering that it's good enough to have people who have good intentions and are interested in people, that's good enough for staffing your services, to saying, well, it takes a lot of knowledge and training and so on to do it. I suppose that would be one of the biggest changes. I think the involvement of the development of groups of users of services, and their insistence and the recognition that they should have a real say in what kinds of services and how they're provided. Mm-hmm. And I think that's one of the really exciting things.
Mm-hmm. And the relationship between those two developments, professionalization and users groups. Well, I certainly appreciate your spending your time with us this afternoon. I wonder if there's anything that you'd like to add in conclusion with our interview today.
Oh, I know. Something that goes back a long way. When I first went into the public assistance branch, I had never worked as a field worker in public assistance. So I was moving in from child welfare with no experience in what I was going to be working in. So that as soon as there was a breathing spell with the new dependence allowance program, which had us all swamped for a while because there were thousands of applications, I spent 6 weeks out in a rural district working as a public assistance worker because I thought I should know what it feels like, you know, down where you're. And then at a later stage when we were starting to use a computer with the program, and we were developing a new administrative system. And when we'd come up with what we thought the system was going to be, I worked for 2 weeks on intake in the Regina region to try out the new system. And I felt both of those were very worthwhile experiences. And not that kind of thing necessarily, but I think exchanges between centralized administrations and the field, staff exchanges periodically, and federally, provincially would be very healthy for the whole system. You wouldn't get the same kind of ivory tower thinking that.
Yeah. Yep, we might understand each other better, and perhaps that cooperative atmosphere would return. Yeah. Again, thank you very much for talking with us this afternoon. I certainly appreciate it. Great.